Hello, in this video we will learn about the high blood pressure causes and the prevention, how to prevent, and we will also understand about how to prevent through diet in home. So this is the person contain blood circulatory system, lungs, and the heart, descending aorta and inferior vena cava. So this is the heart. And heart, let's begin to understand the part of heart as an anatomical aspect. This is the aorta and superior vena cava. Descending, I am not drawing. So this is the right atrium and ventricle, while the here is the left atrium and left ventricle, while the pulmonary artery is used for the circulation and oxygenation of the blood when going to the lungs, and the pulmonary vein will drain the oxygenated blood to the left atrium to the left ventricle, and ultimately the aortic valve which that transmits the blood into throughout the body. This is the descending aorta, and this basically diastolic blood pressure and the systolic blood pressure we can measure, and we can identify through our arm. Anyhow, let's begin to understand the normal blood pressure. Normal blood pressure is 120 over 80 millimeter of mercury. It means the 120 is the systolic while the 80 is the diastolic blood pressure measuring normally. On the other hand, let's begin to understand how to control this normal function of the blood pressure. Like salt restriction, the 5 gram salt should be added in a day, and the avocado and banana using because it is high with potassium. Smoking less because quit smoking because smoking will lead to damage our blood circulatory system and endothelial cell. Fast food inhibition because the fast food will lead to cause many complications like arteriosclerosis and atherosclerosis. Alcohol restriction because alcohol is harmful, and on the other hand the exercise as water also increase. So in this way, exercise will inhibit the abnormal blood pressure, and water. Why? Because water will excrete more urination, lead to sodium excrete. So in this way, the normal function. Most people high blood pressure do not know they have it. Like 1 person in a 5 women have hypertension. Let's begin to understand the causes of blood pressure. High blood pressure, how it can cause. The major lack of knowledge as well as the genetic. Genetic mean the family history describing the hypertension, but the epigenetic also involved, like when we will add the fast food in our diet as well as the bad eating habit will lead to problem and constriction of blood vessel more, and the flexibility will be decreased. On the other hand, the age wise also can cause the hypertension. The flexibility will decrease also. Let's begin to understand the further going on the global hypertension problem. So the 22% average global problem. In the hypertension by WHO record is Africa 27, Southeast Asia 25, Americans 18, and Western Africa 19, Eastern Mediterranean 26, Europe 23, and South Asia East is 25%. So in this way, this is the basically you can understand this is, and the, a more higher risk of the hypertension in Africa and South Asia as well as Eastern Mediterranean and Southeast Asia. So remember, if you are living in this place, so you should prevent and care yourself more because you are living and in that environment where the hypertension is going to peak. Anyway, let's begin to understand the classification on the basis of normal, elevated, and high systolic and diastolic blood pressure. So the normal is 120 millimeter of mercury or less, and the 80 millimeter of mercury is diastolic, while the elevated is 120 to 129 millimeter of mercury and the 80 millimeter of mercury, while the high is 130 millimeter of mercury as well as the 80 millimeter of mercury are more than. So, on the other hand, let's begin to understand the complications. What will be the complication due to the hypertension? So, the blood vessel damage due to the high blood pressure, and the cardiovascular disease, the tachycardia or bradycardia, and on the other hand, the basically thickness of the left atrium and left ventricle. Thrombosis also occur as well as the renal failure due to the more filtration, and on the other hand, the arteriosclerosis, and this is the aneurysm will lead to burst the artery, and on the other hand, the acidosis and the hypoxia and stroke, as well as the arteriosclerosis, the hardening of the blood vessel. Basically, hardening of the blood vessel will lead to more hypertension and the hemorrhagic bleeding due to the aneurysm. Let's begin to understand through graph on the basis of age wise. This is the horizontally show the systolic blood pressure, and the horizontally shows the age group. So the different age group like 15 to 19, 20 to 24, 25 to 29, and in this way you can understand, and in this way the higher minimum blood pressure in the age wise you can understand, and this is the 60 to 64 years old person will more blood pressure, and average should be here you can see is a 125, and this is showing in the graph. This is the systolic blood pressure 133 in the passage of age more. When increase more age, this is the average blood pressure, but the hypertension will lead to more increase. The maximum blood pressure is here, and this is basically you can see 154 on the basis of age wise you can understand, and in this way the emergency 149 systolic blood pressure, and in this way the age is 55 to 59. So no problem in the age of 45, but the age of 60 and 64 is the problem. So I hope you make sense about this high BP cause and prevention, and you can learn about the graph by stop this video. So thanks for watching. Bye. See.